Mrs. Jannatul Nayam Lovely. She is a known case of CKD stage 5 and she came to India about 1.5 years back with history of CKD stage 5 and she was started on dialysis. She came to India for the purpose of kidney transplantation. So her parents and the sister were excluded as donor because of the cross-match positivity, and she came up with other relatives to India and she went to multiple hospitals before landing at Jaypee for an opinion about her kidney transplant. After thorough evaluation at different hospitals, she was told that her transplant cannot be done because of her baseline CTC positive. That means her cross-match was positive, her blood was having reaction with all the possible donors that were available, and probably it was because of her multiple child birth histories and multiple blood transfusions in her country. Later on, she came to our hospital, Jaypee Hospital, once she came to know that we are able to do transplants in such situations. Unfortunately, the corona pandemic happened and we had to wait for another 5 months because it was going to be a risky transplant. Ultimately, in the month of August, we started her plasma exchanges. She underwent 8 plasma exchange sessions and this was preceded by one strong anti-rejection injection. And once the titers went down, we asked our surgical colleague Dr. Amit K Devra to join in the transplant program.
The kidney transplant in a patient with CTC cross-match positive is a real challenge. We need to remove these preformed antibodies to avoid hyperacute rejection, where kidney turns blue and non-functional, which may happen immediately after surgery or after some time of the surgery. To avoid this hyperacute rejection, we need to do plasma exchange to remove the preformed antibodies and proceed for the kidney transplantation.
So one of the finest donor was chosen with whom the cross-match was positive but the DSA was less. We had to discuss with her about the pros and cons of going for a transplant in such situation. After gaining her confidence and telling her and her family about all the possible consequences of going for a cross-match positive transplant, we went ahead and did the transplant.
Assalamu alaikum. আমি Jannatul Nayam Lovely. আমার 2016 কিডনি দোনোটা ড্যামেজ হয়ে যায় ধরা পড়ে। এরপরে 1 বছর পর থেকে ডায়ালিসিস শুরু হয়। বাংলাদেশে ডায়ালিসিস করি। এরপরে দিল্লি আসলাম। দিল্লি 1 বছর করলাম। তারপরে বিজয় সিনহার কাছে আসলাম। সেপ্টেম্বরের 10 তারিখ অপারেশন হয়েছে। অপারেশনের পর আল্লাহ দিলে আমি এখন ভালো আছি। Dr.Amit K Devra sir operation করছে।
At our center in Jaypee Hospital in last 5.5 years, we have done 200 such kidney transplantation where there was either ABO or HLA incompatibility, and we have shown a very promising and encouraging results.
Jaypee হসপিটালের সবকিছুই ভালো, উন্নত চিকিৎসা। আমি Jaypee হসপিটালের কাছেও কৃতজ্ঞ। ধন্যবাদ জানাই।
I really admire her and her family for the courage that she took to go ahead with a transplant of such nature where there is a high risk, and we wish her a very healthier, happy future. Thank you, Jannatul, for coming to our hospital and giving us a chance to work for you. Thank you.